Hi everyone, welcome back to Urology 101. I'm James Farrell. Urology 101 is my video blog on common topics in urology that are often taboo or embarrassing just simply because we deal with sex organs a lot. And my content's focused on communicating some useful medical knowledge to you, with my goal of providing you some practical advice that you can apply. Now, this video and all my other videos can be found on my website, which is urology101.com, and the first part of that is spelled Y-O-U-R. Perhaps you're watching this on YouTube. I have a channel there. All the videos are on it. Urology 101 is the name. And I post most days on Instagram. Shorter format, obviously. Great content. Definitely check that out as well. Urology 101 is the account. Now, on to today's video. I actually got a lot of requests to expand on the "Oh no, I gotta pee" video, but not in the way of talking more about urgency and overactive bladder, which is really where that's at, but much more on leaking urine and other aspects to what happens or what causes people to leak urine. So when we talk about just urinary symptoms in general, especially with women when they come in, think of it as sort of like this umbrella, right? And on one side you've got the overactive bladder and the urge people, but on the other side you've got this group of women who come in and say, look, anytime that I jump up and down, or I exercise, or I pick up my kids, or I laugh, cough, sneeze, I leak some urine. And it used to not be that big a deal, and for a couple of years I just sort of dealt with it and leaked a little, and then I started to do panty liners, and they actually on the market, I'm not kidding you, they're actually large tampons, and some women will say, well, I really put like a big tampon in there, and that kind of helped. And all of these things to sort of act as band-aids for what is called stress incontinence. Everything I just described there is what's called stress incontinence. And every now and then a woman will look at me and sort of go, you mean stress is causing my bladder to leak? And they'll look at me like, what are you, an idiot? And sometimes the answer to that is yes, I am an idiot. But other times I'm actually right. And in this case, the phrasing is called stress incontinence because it's some sort of stress that your abdomen places on your bladder, and that pressure causes urine to leak out of the urethra. So most of the women will notice that they're not having full voids. They're just leaking little bits of urine here and there. And like I said, over the course of time, it tends to get worse. So most women have been dealing with this on and off at some level that's been mildly annoying to really annoying for about a year, maybe 2 years, sometimes like 5 or 6. And a lot of people have really changed their quality of life here. Like it may stop women from exercising, and some might complain about gaining weight or having difficulty with, like, honestly, sexual relationships with their spouse purely because of leaking urine. So one of the points here that I want to get to is there are things you can do at home that can help, although they're not perfect. There are surgeries that can help, and they're not perfect, but they're good. Now, stress incontinence is an anatomic problem, and we'll get to that. So it gets fixed with an anatomic solution, and that means surgery. There is no pill that we can give you to get rid of stress incontinence if that's the problem. So how does it happen? Well, it turns out nature plays a little bit of a cruel joke on women, and I know some women are going to think, great, another one. But here's the deal. Most of the time, stress incontinence happens a couple years after women have given birth, or in their 40s and 50s when perimenopausal symptoms come along and the effect of estrogen on tissue isn't quite there anymore. And so what happens is that after having a child and being pregnant, the hips stretch out a little bit. Some of the ligaments that hold the pelvic organs in place become a little more lax. And so the urethra is one of those, and it can move up and down a little bit more, and that's called a hypermobile urethra, and that can be one of the main reasons for stress incontinence. There is another one called intrinsic sphincter deficiency that I'm not going to get into today. We're purely going to talk about hypermobile urethras and stress incontinence in that light. So what goes on there is because of those organs stretching out a little bit and the tissue stretching out, the urethra moves up and down, and that pushes some urine out. And a lot of women will notice this with different maneuvers that, again, apply pressure from their abdomen down onto their bladder. That's what's happening. Sometimes women can feel like this pelvic heaviness as well, and the sensation that some of the organs are sort of pushing down on the vagina. And that goes along with something called pelvic organ prolapse. It is associated with stress incontinence. It is also a different conversation, and I want to leave that for another day. So when we talk about stress incontinence and you come to see somebody, I think there are a couple types of people who are great to see for this. One is a gynecologist, another is a urogynecologist. They just got more training in the areas of pelvic surgery. And then, pelvic surgery specifically related to urinary symptoms. And then urologists, we deal with this as well. So when you come see us, we're going to have a conversation about all of the history that you and I have just talked about here in the last couple minutes. Then what we move on to is really kind of an exam, and a pelvic exam, to look at the anatomy to make sure that, one, everything looks normal, but two, because of the most embarrassing thing we can possibly do to you, which is to ask you to try and push some urine out in an exam room. It can't get any better than that, right? So what we want to do is try and demonstrate it, because if we can demonstrate that you leak some urine, then that really is very straightforward, keeps us from needing to do other tests, and we can talk about fixing the problem because we've diagnosed it. So it's really awkward. It's completely strange, and women usually look at me like I'm ridiculous. But what we really want you to do is try and squeeze, cough, laugh, do whatever. We'll have you do a couple maneuvers to try and allow yourself to leak some urine. It's very weird. But again, it keeps us from doing some other tests. Other tests that may be needed sometimes is something called a cystoscopy. That's where we look in the bladder with a telescope. And there's something else that's really unenjoyable called urodynamics. And I'll allow your doctor to talk with you about that if that's something that needs to be done for you. Now, what are options to actually fix the problem once we've diagnosed it? Well, things you can do at home. Two main things, really. One is Kegel exercises. And this can also be done with a pelvic floor physical therapist, or just pelvic floor physical therapy on its own. And you can find some stuff on the internet in terms of good sort of programs to go through. And I've even had some women come in and tell me that there's an app called Kegel Camp. It costs $2. I do not get a Kegel Camp slush fund, so I don't get any kickbacks. And it's off a podcast of a sexologist whose name is Sex with Emily. But it is a program that takes you through 20 levels of Kegel exercises that's pretty defined and well done, honestly. So I think that's a good option just to keep people on track. Kegels will help keep urine and strengthen the area around the urethra when you have mild stress incontinence. But if you're leaking and going through multiple panty liners and stuff, it's probably not going to provide you a great solution. So one of the other things you can do just to check it off the box is to make sure that you're not dealing with constipation. And at this point, you got to be thinking, God, can I talk about anything else more embarrassing? So what we want for you really is to have, yes, I can actually. What we want is to have one solid, though fairly soft, good bowel movement daily. And the reason for that is there's only so much room in the pelvis, right? Women have a bladder, a vagina, a uterus, and a rectum down there. So if you move out stuff and reduce your constipation, a lot of these symptoms sometimes can get better. Definitely the urge stuff this plays into, sometimes with the stress incontinence. All right, so on to actually surgeries that we can talk about. One of them is actually going inside the urethra and under the lining of the urethra, adding something similar to collagen that doesn't degrade. That's called urethral bulking. So if you think of like the urethra like this, what we're trying to do is bring the edges together like that, and that's called coapting the urethra. So we sort of push the edges together with that bulking agent that gets put under the lining. And it works. It's not perfect, but hey, if the only thing you do is maybe leak a little bit of urine when you're exercising, that's a solution that actually can solve that type of a problem. The more definitive surgery is something called a mid-urethral sling. And what that means is that we take a small piece of mesh and we have it go under the urethra like a hammock. And I'll show you on a diagram in a second. Now, you hear the word mesh and start thinking about problems that the FDA and lay media brought out a few years ago. This is a different type of mesh. The mesh that was talked about with that situation specifically dealt with something that was related to vaginal mesh placed for pelvic organ prolapse. And it was a larger piece of mesh. And yes, there was what's called extrusion into the vagina and sometimes erosion into the bladder. That can happen with the mid-urethral slings that I'm talking about. It is smaller mesh. The rates on that are about 2%. It's a real risk. However, for women whose quality of life is severely affected by incontinence, a lot of times it's a worthwhile risk to take. So it's not perfect in the sense that there is no issue with erosion or extrusion into either the urethra or the vagina. However, it's not the FDA problem that was talked about with the pelvic organ prolapse and mesh related to that. So I want to differentiate those two. Now, in terms of where everything goes and how it looks. So let's take a look at the diagram here. If you're looking at this, okay, things notated. This is the pubic bone right here. This is the bladder. The uterus is up here. All right, vagina here, and the rectum. And this is sort of looking at a woman as though it's sort of like cut down the middle like that. And what I want you to see is the urethra is right here. Now, the sling actually gets placed either from this side going up or from the skin side around the pubic bone, down behind it, and then wraps around the urethra and provides this sort of backboard right here below the urethra so that it doesn't move up and down. It's a pretty well tolerated surgery. The incision is in the vagina, and then there are two little, very small incisions that over time when they heal you really won't see that are right above the pubic bone. And it's mostly a same day surgery. Which means you get to go home that day, and the recovery is really pretty quick. A couple of the women who I've done these on recently are right back up to doing whatever they want in terms of just moving around daily and getting back to work. There are some restrictions, like we don't want people to have sex for 6 weeks. We don't want certain levels of exercise to happen for about 4 to 6 weeks, but people can get back to their life day to day pretty quickly. Now, there are some risks to it, right? I mean, it's not a perfect surgery. We talked about the mesh erosion issue, which is real. Urinary tract infections, yes. Now, clearly, if what you're dealing with is leaking urine, we can make you overly continent or hypercontinent, or another word for that is urinary retention, and that sucks as well. There are answers for that. It's not a common problem, but it's something that can happen after these. So do talk with your doctor about those risks. He or she will absolutely talk with you about them. But I think overall, for women who have a situation where their quality of life is severely affected by leaking a lot of urine, this is a really good answer. I hope that really helps. I hope that clears up some issues in terms of leaking, in terms of the difference of stress incontinence versus overactive bladder and urge incontinence. Urge incontinence is another ball game. That's another conversation. I think it's a really worthwhile one. Some of your thoughts and questions, we'll get onto that one soon enough. You guys have a great night. Thanks for your time. We'll see you soon.